Hello, my name is Chung, and I'm joined by my research partner Rebecca. We would like to take this opportunity to present a study we conduct in collaboration with Hsueh, Cardinal Herrera's Health Science faculty, about the effect of smoking in dental implant recovery. According to World Health Organization, estimated 1.3 billion people globally consume tobacco in some way. Research across various health fields has established smoking as a risk factor for the onset and progression of systematic and oral diseases. Additionally, smoking has been linked to complications in oral surgery by downregulating the immune system and impairing the body's ability to heal wounds. Dental implant procedures are currently leading the way in oral surgical innovation. Dental implants are widely considered the gold standard for oral rehabilitation, and their usage is expected to rise to 23% in the USA by 2026. Drawing on previous knowledge of the connection between smoking and impaired wound healing, as well as similarity between the mechanism of periodontal disease and periimplantitis, we can conclude that this notion will also be true in dental implantology procedures.
To investigate our hypothesis, we conducted a case control study based on the patient population of the CEU Cardinal Herrera Dental Clinic. We identified patients who had received implant surgeries between the 1st of October 2018 and the 1st of October 2023. These patients had no existing medical conditions or chronic medications that would skew results. It was ensured that all patients included in the study had complete clinical histories, clearly stating their smoking status and record of their recovery up to a month post-op. Patients were defined as case, current smokers, or control, non-smokers. We then conducted an odds ratio and chi-squared analysis with an alpha value of 0.05 to determine the relationship between smoking and the incidence of complications. We also investigated the influence of implant placement. When defining post-operative complications, we focused on the traditional signs of impaired wound healing and infection, such as excessive pain, fistula formation, failed osteointegration, implant mobility, soft tissue swelling, and gum recession. The participants in this study remained anonymous, differentiated only by a randomly assigned patient history number to protect their privacy. The study also received ethical approval from the university board. The study consisted of 135 eligible participants, 64 cases, and 71 controls with similar characteristics. While it was determined that the effects of smoking on implant failure, both with and without factoring for implant location, was not statistically significant, some of the results we obtained were consistent with previous proposed mechanisms for implant complications. It was determined that while not significant, smoking had a greater negative effect on anterior implants and those placed in the maxilla. It has been suggested that these areas are specifically vulnerable to the effects of smoking, as the maxilla on average has a thinner cortical bone plate and lower bone density. Furthermore, posterior implants have several physical barriers preventing the infiltration of cigarette smoke. These include distance from the cigarette to the peri-implant tissues and the position of the tongue over the posterior inferior regions, protecting them from nicotine-induced vasoconstriction, thus giving better healing outcomes. Although the results obtained were not statistically significant, the social and clinical impact of smoking on patients in recovery remains clear. Patients need to understand the huge risk that smoking can cause in all aspects of their health, and it should be emphasized that the key to good outcomes in implant surgery is not just reliant on short-term cessation during recovery, but making a lifelong commitment to quitting. Clinicians should feel empowered to inform patients about the effects of tobacco and provide realistic and personalized guidance to their patients to optimize recovery and prolong the life of dental implants. Going forward, we believe that this area of study has great potential to produce new guidelines about smoking in patient recovery. Designing multi-centered studies with bigger population sizes and the introduction of histological data would greatly improve the accuracy of the results that we have obtained. Furthermore, working closely with dental practitioners would ensure that all the information required for the study would be available in the patient history, hopefully yielding statistically significant results.